Gary, to get back to you for a second, tell us about you had a nice interview with 3 really positive outcomes with the 3 ophthalmologists. I know there's a few of our ophthalmologic friends that are intubated now and not doing as well as the 3 that you interviewed. But Alice mentioned this drug called Plaquenil. Can you kind of comment on Plaquenil and maybe azithromycin as an option as a preventive agent? Because I know one of the ophthalmologists was actually on a missionary trip when he converted, and he was on that prophylactically for going to Honduras.
So it's kind of interesting. Plaquenil has been thought to have antiviral effects for a long time, and in vitro it seems to work against a lot of viruses. In vivo, there hasn't been a whole lot of promise with previous studies. But with this one, it's very interesting. Chloroquine came out of China. They said that this is something that was working. Johns Hopkins was very quick to put it on their treatment protocol, along with remdesivir, which is an antiviral that was developed, as we know, for Ebola. So I think those 2 drugs right now are probably at the top of the list. But there's a study out of France that we've probably all read showing a decreased viral load in patients who took Plaquenil. It was even enhanced further if those patients were taking azithromycin. Now, we know it was not a randomized controlled trial. There may be some issues with how the trial was run, but we're in the Wild West right now, and we're all just trying to figure out what to do. The way I think it works, and I think the way most people feel that it works, is Plaquenil is actually a zinc ionophore. So if you're taking a good amount of zinc, no more than 50 milligrams a day, because then you get into some copper deficiencies and some other problems with too much zinc. But if you're taking a good amount of zinc along with Plaquenil, it actually allows for the zinc to actually come intracellularly. And zinc has very well-known, well-described antiviral properties. So yeah, you mentioned actually Dr. Kozarski was down on a mission trip. He had been taking Plaquenil prophylactically to prevent malaria. And he came down with symptoms when he was there, and no one else that he was around got sick. No one else has tested COVID-19 positive. So whether they became infected and just had no symptoms, or it decreased the viral shedding, if you take that anecdotal report of a COVID-19 positive patient who is on Plaquenil, and you marry that to the report from France that shows that it actually decreases the viral load as measured by PCR through, I think, throat swabs, maybe there's something to this. I think that it's something that we're going to find out very quickly, because we've got a lot of patients who are being tested right now and trials ongoing. But I'm very interested to see how it shakes out. I'm also very interested in some of these cytokine storm blockers, these IL-6 blockers, IL-1 blockers, interferon gamma blockers, because it seems that steroids are not the thing to use, which typically we would think, okay, we've got too many inflammatory cytokines, let's start on steroids. But it seems like with this virus, we have to be very targeted in our approach to reducing some of the cytokines while allowing the body's inflammatory system to still, kill the virus.
I'm going to go back to the other 3 groups, but Gary, I know you brought up red kidney beans, so you are are you eating your red kidney beans? That's
so Carl and I talked a lot about this on one of our interviews, but phytohemagglutinin is a property or a molecule found in high concentration in red kidney beans. It's actually higher in the uncooked version, but it's actually toxic. So you can't eat uncooked red kidney beans, for the record. But phytohemagglutinin is actually something that is known to stimulate interferon gamma production. And so in the very beginning, when you have this disease or before you're infected, if you have elevated interferon gamma levels, it seems like that's how you get rid of this quickly, and it sort of goes away like maybe a mild cold or something even less than a mild cold. In older patients, what's happening is the COVID-19 virus is actually blocking the expression of STAT1 genes, and STAT1 genes interfere with the signaling of interferon gamma. So older patients, it seems like, are becoming infected, and actually not just regularly infected, they're becoming super infected. So they have a huge viral load before they start showing signs and symptoms like a fever. And that's why this disease is spreading so fast. So just like Alice was saying, her cousin ended up having a really high fever and going into a cytokine storm, because what ends up happening is once your viral load gets to a certain level, your Th1 system goes into effect and you get a super inflammatory response that's actually over exuberant to what you need. And then you get the cytokine induced pneumonitis. So it's very interesting. I wish we weren't talking about it, but yeah, I do think actually eating red kidney beans may be helpful, if nothing more than just helping some social distancing.